For most of this year, 2020, the fight against the coronavirus has been globally on, with different measures put in place to protect the people. With thousands of deaths, survivors, and active cases on record, many hope and pray for the day that the COVID-19 pandemic will be a thing of the past. In Nigeria, Lagos has remained the state with the highest number of cases, 15,857 now recorded by the Nigeria Center for Disease Control. However, the past few days have seen a twist, as the Federal Capital Territory has consistently recorded an increase in the number of cases. The question is, why this development? Is there any change in measures against COVID-19 in the FCT? What role have residents played in this rise in cases? Or are we simply talking about more testing being done? The program is Nigeria Today, and answers to these questions and others shortly, as guests will address the issue of rising COVID-19 cases in the Federal Capital Territory. I'm Dennis Adigunloye. Welcome. All right, joining me to discuss rising cases of COVID-19 in the FCT is Dr. Ogbonnaya Iheme, a consultant family physician and medical director, Prime Care Hospitals, Gwarimpa, Abuja. Welcome to the program.
Thank you, Dennis. Good evening, Nigeria.
All right, and also joining us is Dr. Teresa Nwachukwu, Deputy State Epidemiologist at the FCT. Thanks also for being with us on the program.
Thank you, Dennis.
All right, let's begin with ladies first. What would you attribute to this resurgence or consistent rise in cases of COVID-19 in the FCT? Dr. Teresa.
Right. Thank you very much, Dennis. I wasn't sure you wanted me to answer that.
Yeah.
So there could be so many reasons. For instance, yesterday, the 9th of August, we recorded 91 cases in a single day, which, like you said, it's really one of the highest numbers that we recorded daily. So there's so many reasons why this is happening. One is that we're actually testing more. I remember I've been on this program quite a number of times, and one of the things we've talked about is our plans to scale up our testing capacities, which we've done. We've decentralized the sample collection centers, and we have more sample collection centers, which means more people are coming up to test. And then we're seeing a lot of people going back to their various countries where they came from with the evacuation flights, and a lot of the flights demand that people test before they can board those flights. So we're actually testing months. So I think this is one of the reasons why that is happening. We're recording more cases, definitely. It's also possible that we're having more infections because of lack of people following the basic rules that we've asked them to do. But yes, you're absolutely correct that we're seeing more cases in the FCT. All right,
Dr. Ogbonnaya, I'm sure you concur with that. What else do you have to add to these rising cases we're seeing in the FCT?
Sure. And just to buttress what Dr. Teresa just earlier mentioned, we are seeing rising cases in FCT, apart from the fact that we are looking at a possibility of increasing number of testings being done by the relevant authorities. It's also possible that a lot of people are now becoming, should I say, lackadaisical about about the protocols we have always harped on, the basic hygienic practices and prevention, all those practices we talk about, the hygienic practices. I think a lot of people are taking things for granted. Some people are looking at that, when you say there is easing of lockdown, it means there is no more COVID-19. So you notice a lot of people do not do the usual protocols. We ask them to washing hands, using hand sanitizers, keeping 2 feet apart plus or more. A lot of people do not do that. And then you can also say, with the churches have started opening now. Nobody really knows how many. How that they try to adapt those practices. I'm sure with all this put together, you know, of course, with the fact that people are coming and a lot of evacuees are coming from, you know, epicenters of the infection. You know, we are talking about recently over 324 cases. I mean, evacuees coming from US, which is an epicenter. And if you factor in that with what a very renowned philanthropist was quoted as saying earlier the last time, he was talking about the test being done in US is garbage. Now, one wonders if those patients, I mean, those evacuees that are said to be negative, that have actually been coming to Nigeria, one actually wonders how authentic, how reliable the certificates that are issued from US might actually be.
I understand that we had Dr. Sani Aliu here some weeks back on this issue. He said there were some protocols that are followed when citizens come back from other countries. I would expect that those protocols would certainly go some way to checking or identifying cases or positive cases of COVID-19, assuming that they are not asymptomatic. What do you have to say to that?
So,
any of you?
Okay. Yeah, it would be nice. I think what we have always done is when people come in from other countries, they self-isolate for at least 14 days, and then they are tested. Just before they exit the 14 days of that isolation period, we test them and then we let them go. So that has been the protocol of what we've been doing, and we're seeing a lot, cases. Actually, we're seeing positive cases from evacuees, people who are returning from other countries. So. And then sometimes people don't want to wait for the 14 days before they move on to different parts of the country, to where they came from. So these are also some of the challenges that are happening. But right now, the process is still, as you come in, you self-isolate, and just before you exit the 14 days, we test you, we let you know whether you need to move from that isolation center to a treatment center, or you can go home. So that still remains the procedure.
All right. Okay, Dr. Ogbonna, just a few days back we celebrated Salah. It seems that there was a reduction in cases during that period. How would you explain this development?
Yeah, definitely we actually saw those cases reduced because many of those state governors were proactive. You know, they were, you know, while they were actually, even when Salah services were being observed, you also noticed social distancing. Kudos to the commander-in-chief who, you know, who actually, you know, set the pace. You know, like if you saw the picture where he was worshiping his Juma service, you actually noticed he had, you know, observed the social distancing. And now the state governors also took a cue and made sure that the Juma services were well, you know, all those protocols were observed. And of course, you know, because the Salah celebration was largely low-key, most people were not, you know, that large gathering of people was not really encouraged. I'm sure that largely contributed to the very reduced cases we noticed within that period.
All right, Dr. Fraser, what would you say to that?
That was a point, but also remember that during that period too, there was also very little testing. Yes, so we saw a marked reduction in the request for testings because people were not calling in. Everybody was on holidays, and some people even assumed that the testing centers would not work. The testing centers were actually working, but I can testify that because I'm on that bit, that the calls that were coming in were significantly reduced. Most people had left the city, so that would also contribute. But yes, we watched the visuals of a lot of people. I think even some states banned mass gatherings even during the Salah, so that might have been a significant contribution to that.
All right, I don't know if at the weekend you saw some political campaigns. You know, the Edo governorship election is forthcoming September 19th, if I've got the date right. I don't know if you saw it, but there was large gatherings. How would you describe the level of compliance with safety protocols against COVID-19 here in the FCT and generally? Dr. Ogbonna.
Yeah, coming to the Edo campaign, I will actually say I was highly disappointed, because you could see the large swath of attendees at the campaign ground. I mean, well, only God knows what is going to translate into, the next coming a few days. So I give them a thumbs down. I'm sure whoever it was that was behind such breakdown of the social distancing rules at that campaign venue needs to answer one or two questions. Now, coming to FCT, we can actually see that the social distancing rules are being enforced as much as possible. You have the task force, the FCT task force doing their job, going from place to place. But of course, like the chairman was saying the other day, there's little they can do, to enforce, people to observe the social distancing. That's why he still insists that we should all see the program as our own. We should own it. When we own it, we don't need anybody to enforce it. We don't need anybody to carry stick and be flogging us and making sure we observe those social distances. We naturally key into it, and then that actually helps as much as possible to bring down the rates.
All right, Dr. Fraser, what's your assessment of people's taking responsibility in owning this fight against the spread of the COVID-19 virus?
Dr. Bunaya is actually correct, because the truth is we really need to own it. If you move outside the city center, if you move outside Gariki and Wuse and you go into some of the suburbs outside the FCT, you would be really shocked at what is happening. People are not really compliant. I was at a filling station yesterday and none of the attendants was wearing a mask. And when I asked them why not, they said, Madam, please, Corona Day here. Really, that was what she said, Corona Day here. Yep. And so it was very disappointing, because she doesn't believe that the coronavirus is real. There's still a lot of people that believe it's a scam, that it's still a government ploy to do something. That mistrust of the Nigerian system is still very deeply ingrained. So if you go to a place like Kubwa, go to a market, for instance, it's still overcrowded. People are not just bothered about the social or the physical distancing aspect of it. Hand washing, I think people are doing a lot in terms of hand sanitizing, and yes, people are doing more of that than actually wearing a mask or maintaining some distances. At the airports, excellent work. I think if you travel recently, you see that at the airports, the port health authorities, they're doing excellently well. Okay. Every place I've been to, they try to maintain all of that social distancing, and the protocols are excellent at airports.
All right. Yeah. Okay. All right. We'll touch on another dimension to that after this break. The program is Nigeria Today, and we're discussing the rising cases of COVID-19 in the FCT. Don't go away. We'll be right back after this timeout.
The number of the COVID-19 cases in Nigeria is increasing daily, with many more tests ongoing. The battle of testing, isolating, treating, and attending to the affected persons rests heavily on the shoulders of our health workers, constantly putting their lives on the line and at risk to contain this virus, save and protect the lives of millions of Nigerians. To these health workers, we at the Nigerian Television Authority, NTA, on behalf of millions of Nigerians, say a big thank you for all that you have done and are doing. To the security agencies enforcing the lockdown and every other frontliner, we say thank you for putting your lives on the line to save ours. There is no amount of words that can quantify our gratitude. Thank you. This message is brought to you by the Nigerian Television Authority, NTA, Africa's largest television network.
All right, welcome back. The program is Nigeria Today. If you're just joining us, topic is rising COVID-19 cases in the Federal Capital Territory. We have Dr. Ogbonnaya Iheme, consultant family physician and medical director, Prime Care Hospitals Gwarimpa, Abuja, with us, and also Dr. Teresa Nwachukwu, Deputy State Epidemiologist, FCT. Dr. Ogbonnaya, just before the break, we were talking about disbelief on the part of Nigerians, and this is how this has affected their ownership of this challenge that we are all facing worldwide. In other countries, you will see cameras going into hospitals, seeing COVID-19 patients. Maybe they'll blur the images, but nonetheless, you'll see COVID-19 images. We don't have that in Nigeria. Do you think that is one of the main factors that contribute to the indifference and disbelief on the existence or the threat posed by this deadly COVID-19? What do you have to say to?
Yeah,
to
certainly. If you take a cursory, I mean, if you actually try to talk to one or two persons on the street about their experiences about COVID-19, what they'll tell you, they will just basically tell you the same thing. That yes, abroad they are used to seeing images, people who are on ICUs, I mean, receiving all kinds of emergency care. But here in Nigeria, the isolation centers, the people who are rather dancing, flexing muscles, doing all kinds of social activities. So, I mean, to them, if that is what COVID-19 is all about, to them it's a scam. Now, some people also, another thing is our celebrities may not be helping matters. A situation whereby people would come out and tell you, I mean, there is no difference between COVID-19 and malaria. I mean, they will criticize what is going on in our our centers, our treatment centers. Let people know that when I went into the treatment center, I actually had only anti-malarials. I mean, there's no difference between malaria and COVID-19. Now, what kind of message are we passing across to these people? Just because now they are now looking at it that, if people who are looking up to do not even believe in the existence of COVID-19, then who are there to believe? So I think the issue comes right from the top. All right, all of us, like we said, we have a part to play.
Yep.
Even if you are not believing, the fact remains. These tests have told you, these diagnosis tests have told you that this is COVID-19. Now the symptoms differ. It could range from the asymptomatic to the mild to the severe. So the fact that you have asymptomatic, or you could even have mild, something that looks like respiratory symptoms, I mean acute respiratory infection, doesn't necessarily rule out the fact that there is COVID-19. So I think a part of the problem is that we need to properly educate, properly inform people, as the case may be, at whatever position we occupy.
Yeah, Dr. Teresa, no doubt NCDC and other agencies have worked tirelessly over the last several months to bring this message home that this virus is real. Do you feel that any further campaigning or sensitization would make a difference on the mindsets of the generality of Nigerians in terms of believing in this fight and owning responsibility?
Short of, I don't know whether Nigerians want us to lie in dead bodies on the street before they believe it, but the profile of the illness in Nigeria, and I think in most African countries, is significantly different from what we saw in the West. And I think that was what happened, because we saw all of these horrible pictures of bodies lining the morgues and the hospitals, and people on ventilators, from the Diamond Princess ship all the way to when we saw all these cases in Italy. So people were expecting that kind of profile, those kind of pictures. And when it didn't happen, they feel like, why? How come? So we have to keep talking. Nigeria NCDC is sending out all these messages, there are all of these promotions, and everyone is saying the same thing. You don't know who is going to fall a victim. We've had very young people who have fallen to this disease. We've had very elderly people. We even have old people who have made through. So you don't have to say, because people are not dying like flies, it's not COVID-19. The virus exists, and we keep saying that this is a virus. This is a family of viruses that has been around for decades, for hundreds of years. The coronavirus has always been there, except that this is just a new type. And the virulence, maybe the virulence is actually going a little bit down, but we all need to be precautious. We can't relax, we can't let down our guard and think there's nothing more to be done. We just have to keep talking, and that's why programs like this are very important, to keep creating that awareness.
Sure. Staying with you, obviously exit classes are ongoing or about to be ongoing. What's your assessment of protocols being adhered to by the students and teachers in the academic environment?
I think there were so many interactions and meetings between school heads, proprietors, and the Federal Ministry of Health, Federal Ministry of Education, to kind of prepare. So it wasn't a sudden thing. They had enough time to prepare. They had enough time to meet, to tell them what needs to be done, what needs to be in place. And the very fact that they're staggering the resumptions is also a positive outcome. So you're starting with the exam classes. And of course, by the time these people are leaving, then you can actually bring in other people to kind of reduce all of that crowd in schools. So I think they've done well. What we need to do more, especially, is when the public schools, especially the public schools, when they start, that's where I think we might have some little bit of challenge. But if the spirit and the preparations that they have put in place continues, I think our students would do very well. We have, the records show that children and young people do very well with the disease. So if we do the basic minimum that we need to do, I think that our kids will be safe in school. All
right, Dr. Ogbonnaya, is there an explanation to this fact that more men test positive for COVID-19 than women? Is there any logical explanation for this?
Well, I should think from the, if we're going to come from immunological standpoint, men have actually been, that actual theory may not stand, because men have been shown to demonstrate more immunological reaction to certain sicknesses. But I think that because of the nature of man being more adventurous, the woman may want to sit back, when she hears there's COVID-19 easily spread by social contact. She may want to stay back, as much as delay her encounter, in offices and wherever she wants to go to, delay her encounter with the society. But I think the man being, because of by nature, by what society has thrust upon him, the expectations upon him, becomes more adventurous, and of course goes out there, and of course, becomes
more exposed.
Yeah, more exposed.
Yeah.
All right. What would you say to that, Dr.?
Yeah, I totally agree. I think the exposure among men, it's much higher. Like I said, men are more mobile. They're more outside in the workspace, whereas you have more women. Don't forget that a vast majority of our women are not working class women. Yeah. The vast majority of women are I won't say homebound, homemakers. So they're likely to be more protected. So even during immediately the lockdown was lifted up, more men were out there than more women. So that could be a very significant factor. And then I think women also have that resistance. I don't know if Dr. Ogbonnaya agrees. Women have that more resistance to infection. Sometimes they could write it out and wouldn't even know that something had happened. But I think men are more mobile and more exposed, Sure. Their networks are wider.
Yeah. And Dr. Ogbonnaya, around the world, there's frantic efforts by medical experts and researchers to develop a vaccine against COVID-19. How optimistic are you that we will see vaccine in the foreseeable future?
Sure. I think with all the good, impressive news coming from around the world, you have from Korea, you have from China, you have from Japan. Before now, we're actually looking at the earliest time for development of vaccine being sometime in its second quarter of next year. But with the way some countries are going, for example, China, we are looking at getting the vaccines out before we enter into the next quarter of 2020. That's something very impressive.
All right, we certainly hope for that. All right, Dr. Ogbonnaya Iheme, consultant family physician and medical director, Prime Care Hospitals, Gwarimpa, Abuja. Many thanks for sharing your thoughts and expertise with us on today's topic.
My pleasure.
And thanks also to Dr. Teresa Nwachukwu, Deputy State Epidemiologist, FCT. Thanks also for your insights with us.
Thank you, Dennis.
All right, and thanks to you out there for watching. Nigeria Today is live every weekday at 7:30 in the evening, and you can watch this and other episodes on youtube.com/NTA News 24 Hub. I'm Dennis Adigunloye. Thanks for your company.